So how you doing today? Y'all already know it's your host, Lacey G Soldier Turner. And today I got a very special guest with me. He's a US veteran and healthcare administrator with 20 plus years serving both profit and non-profit sectors in the hospitals, health centers, and veteran medical services. He's been doing a lot of great things in the community, and we finna get to hear, some of the things he's been doing to hear his story. So, without further ado, I want to welcome the wonderful, amazing, talented Dr. Ronald Griffin. Welcome to the platform.
Hey, thank you, Lacey. I appreciate it, brother. I was thinking to myself, who the hell is he talking about? Hey, but bro, I appreciate you. Thank you for that wonderful and gracious introduction.
No problem. So, before we get into what I want to talk about, I want to let the people know a little bit about you. So, can you let the people know where were you born and raised, and how was your upbringing as a child?
Yeah, I'm from born and raised in the city of St. Louis, brother. I remember, my childhood was one where my mother just really early on needed some help, and it takes the community to raise a child. So my
Mhm.
grandparents stepped in, for most of my younger life, my grandparents were that force. Even though I saw my mother every day, bro, ain't no shade on mom's Dukes. She's still that number one in my ace. But my grandparents were the one who really forged who I am today.
Okay. So,
Yes, sir.
for the people listen who never been to St. Louis, they always say we the top in the murder rate and all that. They want to come visit but might be scared. What can you tell the people about St. Louis who want to come here but might be scared?
Bro, we are good hometown folk. We treat everybody with dignity, respect, and admiration. We welcome anybody to come to St. Louis because we will show you. We call the show. We not called the show me stay for nothing.
Facts.
We really will show you a great time, and we welcome you and your hospitality to come and just experience the wonderful things that we have going on here. It's a lot, and sometimes it gets, overshadowed by some of the negative stuff. But what I tell you is that mostly, probably 98% of the things that happen in St. Louis are all positive.
Facts. Look, you hear that?
Yeah,
Listen. And
yeah,
look, me and Dr. Ronald, we still alive. So y'all can come on
yeah.
here.
Hey, and we from that place, right?
Facts,
That
facts,
they talk about is
facts.
so bad, and it's a
Yeah.
lot of us that came out, brother. I have five brothers and five sisters, bro, and we all came out just fine.
Yeah, me too. Hey, same
Yeah,
thing. So
blended family.
let me ask you this, Dr. Ronald. How did you or what made you get into the healthcare field?
Man, I've been thinking about this for a very long time. When I was a little kid and didn't realize it, I'm watching shows like Dr. Kildare and Marcus Welby and everything, bro. But that wasn't the real deal. The real deal was my grandmother, who was a nurse. On both my paternal and maternal grandparents were nurses, my grandmothers. And my mother is the best nurse that I know, hands down to this day. I've never met another compassionate, just healing touch and focus and professional person in this role as my mom. So, and then naturally, bro, it's just a natural progression for me. I thought I wanted to be a doctor, but my mother had that conversation with me. And, really, it's really interesting, bro, because I was like, you know what? I would never, ever be a nurse, right? But
Yeah,
I mean, that's real talk, man.
yeah,
But the thing
hey,
about it was, uh, she uh, she never gave up, man. And she was just giving me the benefit of the doubt and saying, you might want to consider this because you can do anything in nursing. And I'm a testament to that.
mm, okay. Okay, so let me ask you this. So you did that. You got your 20 years in. How did you become the chief operating officer at People's Clinic?
Yeah, that's and so first off, man, shout out to Betty Jean Kerr People's Health Center, bro. When I tell you we're doing some remarkable things in that space, if it not, we have two CEOs in the history of our company. That's Betty Jean Kerr herself, and then her son took over, Dwayne Butler, who has just been an extraordinary visionary and being able to put this whole thing in motion, right? And
Mm,
so uh, I worked for Betty Jean Kerr as the West Florissant site manager about 20 years ago. And it was really, short-lived because I was still, practicing as a nurse and I enjoyed that hands-on with the patient and such. So then from there, bro, I just started wanting to do things differently. We had to change some policies and the perception of what goes on and those policy makers and those rules and regulations that were put in place for the marginalized people of our community. I couldn't sit with that and just let it happen. And I'm talking from hospital systems to community health centers. And, that gave me a notion to want to do something different. So I wanted to be a policy maker and,
Mm,
not just the doer of the things that they say do.
gotcha.
Yeah, so that's how I got there, bro. Basically, I have a bachelor's degree in nursing, I have a master's degree in healthcare administration. Then I got my doctorate
Mm,
from Baylor University, doctorate of nursing practice, Sikkim Bears. So,
mm. Good.
yeah, and that's and
Salute,
then,
salute.
yeah, bro, I had them they took a challenge, they took a chance on me. I have some great work that I've done by some extraordinary people. I've had a lot of great people in my life to help mentor and coach me
Mm,
to help propel me for this step.
mm.
And I think that there's so much more to do in this space, and I want to help anybody who's open to it and ready for it. But shout out again to Betty Jean Kerr People's Health Center. I got to blow that horn,
Salute to
bro.
ya, salute to ya.
Yes, sir, sir. Back to you.
All right. So look, so even speaking with that, yeah, celebrating local community progress. So
Yeah,
talking about the merge of, Betty Jean Kerr's People Health Center and Amanda Luckett's Murphy Hopewell Center. Why was this merger important?
bro. See, the little known history fact is that People's Health Center acquired Amanda Luckett Murphy Hopewell Center in 2010. They acquired them.
Mhm,
So they put a different board in place. They were governed by different rules, but they had some shared service, right? And even in 2010, they had a shared service model. They had one CEO, one
okay,
uh, human resources, one facilities, one security, but they were just operating in as an entity. And so we had a management agreement with People's Health Center. So let's fast forward now. November 30th, 2024 was when the rubber met the road, and again, Mr.
mhm,
Butler's vision and just his forward thinking made this
mhm.
possible. And then we had the people in the right seat. So our executive management team, hands down, best in this game, best in this game. I'd probably get some people arguing with me, but from where I sit, best in this game. And so the
Gotcha.
remarkable thing about that, yeah, the remarkable thing about that, Lacey, is because we become a one-stop shop. So that
Okay.
means that you can bring someone up there who has diabetes, and then we
Mm.
discover through working them out in diabetes that they need their teeth done. And so we can make those appointments too. And then when they need their teeth done, they're complaining about some pain in their ankle. And if we need to get them x-rayed, we can do that too, right? But then
Yeah.
let me tell you this. And then they found out through the assessment that they're having some difficulties coping. And so we got that too under the behavioral health side, bro. So when I tell you we are truly a one-stop shop, WIC
Look,
services, podiatry, our own lab,
yeah,
our own
that show.
pharmacy, our
Look,
own
that show.
radiology, bro.
That would show what I was going to ask you. What service or what all service do you provide? But you just let me.
Bro, yeah, man. Hey, so we really serious about this, and that's just the primary care side. On the
Mm,
behavioral health side, there's a plethora of programs, residential housing. We have our CRC program, and what we have is we have a program for children, adult,
mm,
adolescents, and even families. We do group therapy and sessions with them as well. So
mm,
we have some phenomenal providers over on the behavioral health side. And then the CSSs, those are the people boots on the ground.
mm,
They're right there. These specialists are right there with them every step of the way. If they need a ride to the grocery store, the specialist will do it, right? And we just want to help people in their circumstances, meet them where they are, and provide them those wraparound services that they so woefully deserve. And then that's why, Lacey, and I have to say this, that's why it's so important that I'm here in DC right now, and
mm,
our CEO front and center talking about these things that are
mm,
freezing funding for organizations just like ours that are trying to do the work of the people. Think about this. The work that we do for population health and health equity and access saves the country money.
mm.
That
Right.
means your emergency room's not full,
See. Mm,
you know? And then here's the key. Anybody can come, Lacey. We don't turn you away. We
see.
welcome you with open arms.
That's great. So even if they ain't got insurance of that.
Say that again. No, brother. No, listen.
Yeah.
We have a sliding fee scale, right? So
Mhm,
if you make so that sliding fee scale is based on the federal poverty guidelines. So
mhm,
when you come in, say you make $18,000 a year.
Hmm.
Your copay is, I think, $20.
That's
That's
crazy.
for all this. Yeah, bruh. You feel me? $20.
Yeah, I heard that, man.
I mean,
Look.
that's real. And then not only that, but if you come in, we have something called navigators, and our navigators help you navigate through the marketplace so you can get insurance. Those who fall under that auspices, they can get the Medicaid, they help you with that. Those can get some ACA type insurance plans, they help them with that. Now, those come and they're a little expensive at times, and that's something that the health system is working on. But for the most part, bro, you can come. We'll take you as you are. You can come and be seen same day in a lot of cases. And
Wow.
that's on both sides. That's the primary care and the behavioral health side. If you have a dental problem and you having pain, you can be seen that same day there too.
Wow.
Hey,
Hey
Lacey,
man,
that's 5701 Delmar
hey look,
Boulevard.
hey,
That's
man, salute, hey, look, salute to you.
that's all. Yes, sir. Yes,
Hey,
sir.
look, speaking of that, like you just gave that address, like marching forward together, a celebration of hope and wellness. So this
Yes.
coming up. Can you tell the people about the ribbon cutting ceremony that y'all got going down at
Yeah,
the
thank
address?
you.
It just said
Bro,
5701 Dale Bar,
hey,
February 21st. Let them know.
we are shutting it down. We want the community to show that we are better together, man. When we walk in unity, there's nothing that we can't be stopped. So there's this quote that says that social solidarity is the moral core power for the powerless. Not
Mm,
my words, but it
mm,
resonated so deeply. So what we plan to do is we're going to the site of our new building that's going to be starting fourth quarter 2025. We're going to start breaking ground on that one, and then we're going to take that ribbon all the way down from there, go
mm,
past our children's building that has those psychosocial uh, residences in the buildings for people to get that
mm,
help they need in this room that opens up, lets them do drawing and art to help them get some of those emotions out. Down on the bottom level is our child dental care for children. We take that,
mm,
go on down past Root Porter Park. Then you come to our adult behavioral health building that does everything under the roof. Take that down to 5701 Delmar. We have a contiguous
mm,
campus, brother. That's
mm,
that's what we have here. And so we want the public to come out. We're gonna have some refreshments, some music, and it's really gonna be a social gathering of showing how much power we have through solidarity. And that means that that's a show of everybody. I believe that you're gonna see a who's who, and that's really just our patients.
mm,
That's our clients, that's our community. We welcome them out. It don't cost them nothing. We'll have people on standby to do whatever they need. If they need a vaccination for COVID, we'll better take care of that. If they
mm,
need if they need to have a primary care doctor, we'll take care of that. If they got that tooth I was telling you about, we'll take care of that.
mm.
So come and see us, check us out. It's gonna be a great time. I hope to see you there, Lacey.
Yeah, I'm gonna try to definitely come out. Hey, listen, yeah, I'm gonna put the flyer in the article. You know what I'm saying? You get the flyer and you get a chance to win a gift card also.
That's
I should
right.
have seen that on the flyer. So I'm gonna
That's
make sure I
that's
do
right.
it. Okay,
Hey, Lacey, and we're
uh,
gonna have refreshments and stuff too.
I see. I see. Come on, y'all know y'all love refreshments. We as black people love to refresh.
Yeah.
Come on now.
Right.
So let me ask you this. So, with all this stuff you've been doing on your journey, what would you say has been your greatest challenge?
The greatest challenge doing the work that we do, man, is funding,
Mm,
especially in this space.
mm,
So we are one of the fortunate ones. Again, I got to give Mr. Butler some shouts out, man, just because he's a banker by trade and he put us in a very good financial position so that we don't just count on grant funding to make our ends meet. But,
mm,
he was phenomenal in just kind of thinking outside the box to bring some other opportunities. So the funding piece to me is the most, the barrier,
mm,
and then just letting our people know that we take care of you regardless.
mm,
And I see, and I don't understand that, right? When people have organizations, and we're not the only game in town, I would say that we're the best, but we're not the only. So
mm.
I may be biased, I'm just saying, but no, seriously, you can get those services from any one of us, but we want to have a personable uh atmosphere for you to come in and not be judged. We meet you where you are. And the barrier is just getting people through the doors. And I mean, this is the thing. We don't have any barriers for them being accessed in. We just want them to show up. A
Mm-hmm.
lot of these health disparities that we have, we manage those really good. And there's some things that we don't do so well, but it's a work in progress, right? If I was going to stay in here and say that we don't have any problems, I would be lying to your audience, and that's not the
Yeah.
case. We have those small operational inefficiencies that we're trying to fix. And when I tell you, you bring it to our attention, we fix it. We don't just marry it and say, okay, yeah, we fix. No, we fix it. We get it done.
Got you. I got you. I like that. I like that. Okay,
Yes,
so
sir.
on the flip side of that, what would you say has been your greatest accomplishment?
Man, the flip side is when people do come in. And
Mm.
man, I can give you stories, man. Young lady came in. No, I'm gonna tell you this story real quick, bro.
Okay, go
Young
ahead.
sister came in and I was just rounding. And she came in into the 5701 Delmar, and she wasn't our patient. She
Mm.
belonged to another agency, but unfortunately they couldn't see her that day. She came in and we were able to service her. We don't care. You get what I'm saying? And
Yeah.
it's those little things that we do in our spaces that make the difference in people's lives that they need to know about. So she didn't have any pampers. She didn't have any pampers. She didn't have any formula for her newborn. You know, how many places can you go and talk to the pediatrician? They match up the formula she's taken somewhere else. We provide her free of charge that, and then give her some pampers. And then here's a card. If you have anything else, if you need anything else, please let us know. Come and
Mm.
see us, or go back to your place where you get your services, and then you will come back. But I'm just saying.
You will come back. So let me ask you this, Dr. Ryder. With we just had the passing of Irv Gotti. I know you probably seen that from the
Yeah,
stroke. Can you let the
yeah.
people know how important it is to like always go help make sure your health is right, go to the clinics and all this type of stuff?
So, when we start talking about social determinants of health and social drivers of health, what happens is, man, we get so busy as our community, and then we have to make a decision. Do I go to work or do I go to the doctor? And so, because work means money coming in to take care of my family's needs. And then, so what we have to do is change the hat. The hat needs to be, without me, this doesn't work.
Hmm.
So I have to make sure that I keep my healthy eating, my healthy sleeping patterns, and just being mindful of the things that I take into my temple. So we also do that, right? We have a social action arm, a community action arm that we give real food every 2 weeks. So when the summer comes around, we'll start every 2 weeks, man. We'll be having food drives from 10 to 12. And you come. You don't just get the canned goods, you get non-perishables, and we give meat. We give, you know what I'm saying? Most places
Yeah,
you go to the cupboards, you get the canned good. No, we give
fact.
meat
Yeah,
and
fact.
produce and stuff when you come by. And we do this most of the summer. We have summer school feed the children's programs.
Mm.
We do a lot, bro. We do a lot. So that's what we need to do. We need to concentrate on our health, and we need to make that a priority. How we do that is places like ours that lets you come as you are, and we treat
Mm.
you accordingly. Now, it has to be a marriage,
Okay.
right? It's not just me telling you what to do. I need you to be engaged in your
Fact.
health care, and then have some ownership about, if I go to a doctor, the doctor says, I want to put you on this medicine. I'm like, whoa, whoa, why medicine? Why
Hmm.
do I need this? Tell me. And then what other alternatives can I do? So
Hmm.
you're telling me that if I manage the amount of salt that I take, and I watch my intake of alcohol, and I practice everything in moderation, then I can start working on my temple and start feeling better. But yes, I need to come and see you in three more months just to
Hmm.
make sure that those things that I've done are working. And
Hmm.
then if they aren't, this is what you get, right? We
Yeah,
want to give you we want to give you the recipe for success.
yeah.
And that's what, man, Herb Gotti is a passing, bro. And listen, he had
Facts.
plenty of money, but he didn't value his health.
Facts.
Plenty of money.
It's
And
only
then
50,
it's the
only
warning signs.
54 years old too.
54. And it's the warning signs too, bro. And the only way you know the warning signs when something's not right, do something. Come and see us. Come and see somebody. If it's not right, don't wait till the last minute. Like
Exactly.
in a stroke, I can imagine what happened. He had this terrible headache, right? And
Hmm.
then, well, let me just, well, it'll go away. Let me go to
Yep.
sleep,
Yep.
or
Yep.
let me take this Tylenol or something. Oh, it's still there, something wrong. Next thing you know, his speech gets slurred and he
Yeah.
starts becoming unconscious and he loses the function of one side of his body, and then if nothing happens, if it's a hemorrhagic, meaning a bleeding stroke, or if it's a clot, I mean, if you have a clot in your brain, we can fix that. But you
Mhm.
got to go.
Facts.
You got to come, not us.
Facts.
You have to go to the emergency room for that
That
one.
right. See?
Don't come. 'Cause you come to me, we sending you to the emergency room.
You gotta go to the emergency room for that one.
Right. But preventative type stuff,
Yeah,
bro, we, we,
yeah,
we certainly need to be more cognizant of that.
got you. Yeah, so can you tell the people where can they find you at, find some more information if they want to go look up some more information about the clinic?
Yeah, you can go to phcenters.com. Uh, that's where the magic lies.
Mhm.
www.phcenters.com. You don't have to put the W now. Just go to your search browser, put phcenters.com, and lo and behold, you'll get all of our services. And the wonderful part, we have this thing called Luma. It's part of our EHR, and it's patient
Mhm.
engagement. So you can make your appointment through your phone. You have your patient portal. We offer that. If you want to change your appointment and you want to be put on a wait list, you can do that. It just gives you some control. And I need you to be involved. This is for your audience, Lacey.
Okay.
I need you to be involved in your care. It is the only thing that you can do to make sure that your health is going to be 100. And I said 100 on purpose because I wanted them to understand what I meant.
100.
100.
So look, y'all, it's going down the ribbon cut. Make sure y'all come out February 21st from 11
February
a.m. to 1 p.m.
21st, 11 to
What's
1.
that? What's the address again?
5701 Delmore, St. Louis, Missouri, 63112. Check this out. Look at the billboards. We got billboards out there to direct you to see us. We out here. We
And
out
look,
here.
they got refreshments. Come on, yeah, refreshments. I know
And
y'all want some of the
refreshments. And refreshments, my
yeah,
brother.
I know you want some of the refreshments. So before you get out of here, my last question that I like to ask all my guests,
Okay.
when it is all said and done and you are long gone from this earth, what is it that you want the people to know about Dr. Ronald Griffin?
My hope would be that I gave people everything that I could give them to make the best decisions for themselves and generationally for their families. I'll be 100 with you, man. There's so many people that I want to coach and mentor and help grow and develop. And I
Mhm.
can probably pretty much count them on my hands. Well, both of them, the ones that actually took me up on it, bro. So, I challenge people to reach out for some mentorship so that you can get to that place that you need to be in your life and get that coaching and that sponsorship. And so everything can be done. If a brother like me from from 40 uh 49, 45 Margaretta, you know
Mhm.
what I'm saying? From 5592 Floyd and Walnut Park can get this, bro.
You gotta
I
say,
know, I
uh,
know that anybody else can because there ain't nothing
uh,
special about me, bro. I just had a praying grandparents and a mother who loved me unconditionally. Feel me?
uh, I like that. I
Yeah,
like that. I love the answer.
yes,
Well, I
sir.
appreciate you, Dr. Ronald Griff. I'm gonna let you know when I write this article and everything about you, but I appreciate all the knowledge and jewels that you dropped on this interview.
Hey, bro, they can come and see me. Come to 5701 Delmar. Ask
57 on
security.
what damn boy.
Come and holler at me, man. I love to sit down with whoever, and we field all questions. Lacey, truly a pleasure, man. I enjoy what you're doing in this space. Thank you for your energy. Thank you for your dedication to St. Louis. Anything that I can do, bro, to be successful, to help you to be successful, please let me know.
All right, thank you so much. We'll definitely be in touch. You have a good evening.
All right, bro. Peace and blessings.
Peace and blessings.